In a House committee today, our Julie Dunmeyer starts us off. She talked to the Healthcare Association of Michigan to get their take. Julie.
Doug and Annie, it's a tense topic, and then the legislators say they all want to keep Michigan's most vulnerable safe, but how to do that is what's up for debate.
Melissa Samuel, president and CEO of the Healthcare Association of Michigan, talking about Senate Bill 956.
I don't think the bill's necessary. I think all of this can be done outside of legislation.
The bill passed in the state Senate earlier this month, brought on by Senator Pete Lucido of Shelby Township, would require nursing homes to not admit COVID-19 positive patients, instead creating isolated facilities for those who are positive to be moved to for care.
I think ideally, if we have the capability to do that, it's a good option.
But Samuel says as things currently stand, they don't have enough resources to provide that location.
There's a lot to that. It's finding enough buildings. It's finding the staff, the resources. I don't think there's any one bullet answer to any of this either. So it's a concept that again, I think it's a good option if we have enough lead time, if we have the resources behind all of it.
She also mentions the challenges of moving patients.
You don't want to have to move patients long distances. There's definitely issues with, we refer to it as transfer trauma.
Nursing homes have been a common place for the spread of COVID-19. Currently, their residents account for about a third of the state's total deaths. Senator Lucido says his bill is a way to keep those most vulnerable communities safe. But State Representative Leslie Love calls the requirements it would put on facilities irresponsible.
On September 1, 2020, a lot of things happened, according to this legislation, that's really impractical, impossible, and irresponsible if we were to move this forward.
The actions in question would be creating and presenting a plan for these centralized facilities and having them ready to operate on the same day.
The bill says it must be available for use on the same day that the plan must be presented. This is problematic, and it's irresponsible for us to move it forward in this form.
Samuel says they want to help Michigan's residents in long-term care facilities, but a new law might create more red tape, and the concept is one they've already been doing.
The concept of isolated or dedicated only building is something that we actually had advanced early on when COVID was just presenting in Michigan.
This has also become a political issue, with Republican leaders blaming the governor for the deaths in nursing homes, saying she forced them to accept COVID-positive patients. She says that's simply not true, and that the state only followed CDC guidelines to allow nursing home residents to return to an isolated area once leaving the hospital. The bill is still making its way through the House. Live in the newsroom, Julie Dunmeyer, Fox 17 News.
All right, Julie.